Hey, so this is the waiting room for MBSPro as a follow-up video to the previous part, which was how to increase your billings. Talked about your value and your volume, to increasing your revenue per encounter or increasing your volume as levers that you might pull. Bearing in mind there are a few other caveats to that, such as demographics of patients, type of niche or unique skills that you might have in the context of how you practice. However, this is what MBSPro can offer in helping you optimize your billings, see your patients pretty effectively and efficiently, as well as ensure that we're optimizing for PAV, so patient annual value. PAV essentially is the total value of possible billings that you could have for a patient, and that is different for different age groups. As you're probably aware, there are different items that can be billed based purely on age. There are some that are based on demographics, such as being Indigenous. There are some for patients that have medications and medication issues in the context of home medication reviews. The waiting room that we have within MBSPro, this syncs with best practice. What it does is it pulls out your patient waiting room, so all the people that are waiting during your day, and then we display a few metrics that we think are helpful. So metrics such as possible billing opportunities. This is based on two different things. So this is based on one, previous billing history. So it's really useful to know when a patient is coming up due for their care plan or their health assessment or their Indigenous health check, which is billed every 9 months as opposed to 1 year for other health assessments, or if a patient is going to be eligible for something based on their pre-consult. So we send a pre-consult to the patient, which just asks them to fill out what they're coming out with. In this pre-consult, we also prompt for a few different things. So if a patient is in a certain age group, we might say, hey, have you had, for example, your shingles vaccine because you're over 65? Or we might say, you're over 30 now and you've mentioned that you need a blood pressure script. Have you had your cardiovascular heart health check? Or you're over 75. There's a number of different things that we prompt for: DVA, CVC program, care plans, health assessment, medication reviews, high value things. So going back to our first video in talking about value and volume, we're trying to optimize MBS utilization. When we're optimizing all of these other MBS item numbers like health assessments, care plans, etc., it does allow us to then optimize visits in between, where we might consider private billing, bulk billing, and providing wraparound care with sort of standard attendance item numbers. Now, the thing that we do, which I'll show you in terms of volume, is we do an estimation of how long an appointment or how long your appointments for the day are going to take. You can see here I'm booked in for supposed to be about 3.5 hours worth of appointments, but because of my average length of consult times based on the previous consults that I've had with these patients, I'm probably going to be running about 15 minutes late, which is not too bad over a 3.5 hour sort of session as such. I've had times where it's predicted that I've run 2 hours late. That's because I had quite a few patients, probably the type of patients that I was seeing. So it is a handy tool that gives you an idea of how late you're going to be. Now, I had another day where it said I was going to run 10 minutes early because all of my patients that I was seeing, at least on that day, all fitted in with their normal appointments that they had booked, which was great. For example, you might have a patient that usually runs their appointments to 18 minutes, but if they've booked a 20-minute appointment, that's A-OK. We're going to run on time. Not so great in terms of MBS, 36 is more valuable than an 18 minutes. We also show you a total billing opportunity. So even on 18 patients, you'd be surprised at how much billing there is available for every single patient based on demographics, age groups, care plans. So 18 patients, I've actually got $8,195 worth of opportunities. It's unlikely that you're going to bill all of those. There is a metric called billing efficiency. Billing efficiency essentially is all of your theoretical opportunities that are available versus what you actually billed. A pretty good biller would probably sit around 50%. That would mean I'm billing $4,000 on 18 patients. That's I would say I would get out of these 18 patients probably 2.5. So that's like 30%. But it's something that we can track within our dashboard, so we have that metric in there. So looking back at our patients, we can see that we've grouped them by MBS opportunities. So for example, we have a couple that are due for the over 75 health assessment, new care plans, medication reviews, cardiovascular health assessments, and menopause health assessments. That's a 695 new item number. So it lets you know which of the patients are due for what, and then we've got the pre-consult that'll say, the patient's coming in for their diabetes, needing some scripts. These are the specific item numbers that the patient is due for. We also provide some handy information. You can bill a 23 with it, but only if your acute issue or health assessment started during the attendance. So we're really big on helping GPs figuring out the MBS, optimizing it to enable you as the GP to provide really great care to your patients. So hopefully that's been valuable, this sort of 2-part series. I'll do another video on how to bill $1 million. Super clickbaity, but it's pulling together the framework that we talked about, part one, waiting room that we talked about here right now, and improving our billing efficiency and really pulling up those numbers in the context of the value that we're providing our patients. So thanks everyone. I'll leave you to it. Bye.